Thank you so much for joining. My name is Kate Fleming and I am with White Birch Communications. And thank you for joining in to the news conference of the Community Behavioral Health Association, speaking in support of passage of House Bill 1623. A couple of things before we get started is I have everybody on mute except myself, and I will be putting all of the speakers off mute. And then at the end of this, we have three speakers. Jay Couture, who is the board president of New Hampshire Community Behavioral Health Association and president and CEO of Seacoast Mental Health Center, Inc., followed by Cynthia Whitaker, who is the Chief of Services with Greater Nashua Mental Health, and Ashley Mills, who is a consumer with West Central Behavioral Health. When they have finished speaking, I'm going to ask that anyone who has a question, please raise their hand. We have disabled the chat function just so we can monitor all of the questions through the raising of the hand. So with that, we are going to get started with Jay. I will turn it over to her, and here we go. Hello, Jay.
Good morning. I'm Jay Couture, the president of the New Hampshire Community Behavioral Health Association, which is the organization that represents our state's 10 community mental health centers. I'm also the president and CEO of Seacoast Mental Health Center, which serves the eastern half of Rockingham County. First, let me report that despite the unprecedented challenges of the COVID-19 pandemic, Seacoast Mental Health Center and the other 9 community mental health centers are open and have remained open since the beginning of the state's emergency order. We did not close and have continued to provide care throughout this time. There have been some very challenging issues, including access to personal protective equipment, protecting our workforce, keeping staff and clients safe, and ensuring access to testing that we have had and will continue to address. We are seeing an increased need for mental health services, one of which is coming from the impacts of remote learning and social isolation on children and youth. The reason we've been able to continue to care for our mental health consumers is because of the rapid steps taken by the Centers for Medicare and Medicaid Services and the Governor's Emergency Order number 8, which paved the way for comprehensive telehealth services to be deployed. Under these orders, we've been able to provide upwards of 90% of the care we were providing prior to the COVID stay-at-home order. Our next speakers will detail how some of this has worked for our staff and consumers. Given the positive experiences with telehealth, its expansion for access to care, and positive consumer acceptance, there really is no going back to the way things were. We can't put that toothpaste back in the tube. Telehealth services remove the barriers of access to transportation and coordination of childcare that can impede access to office-based care. The first step in stabilizing our current telehealth platforms will be the passage of House Bill 1623 relative to telemedicine and substance use disorder. This bill and a proposed amendment will be on the Senate floor for a vote tomorrow, June 16th. CBHA strongly urges passage for these reasons. It will ensure that clients have access to health care, including mental health care, in modern and smart technology platforms. It will include critical sections about parity so that providers can be reimbursed properly by both Medicaid and commercial insurers. It will ensure access to substance use disorder services through telehealth. It opens up the ability to provide telehealth services to a very large group of provider types in New Hampshire. It also allows for audio-only care, as access to broadband and smart devices are still not available to many New Hampshire citizens. A real benefit of this bill is that it will make permanent some changes that are now only enshrined in an emergency order. So if there is a second wave of COVID or another health crisis in the future, we will not have to turn the switch on and off. We all know that not every healthcare service can be provided via telehealth. Some services, like medication injections, needed to be provided face-to-face throughout the pandemic. A lot of care will require returning to the healthcare office or clinic setting. However, I think soon saying that you're going to the doctor's office might sound like someone today saying, I'm going to fax my video order to Blockbuster and drive there to pick it up. It just doesn't happen that way anymore. As I mentioned at the beginning, access to telehealth care during the COVID-19 pandemic is based on both state and federal steps that were taken. House Bill 1623 will address a lot of state issues, but we will also need to have the federal government come forward with permanent changes in the months to come. I would like to now invite Cynthia Whitaker to talk about how telehealth was used in the community mental health centers during the COVID-19 crisis.
Good morning, and thank you, Jay and the New Hampshire Community Behavioral Health Association for inviting me to share today. I'm Cynthia Whitaker. I'm a psychologist and the Chief of Services at Greater Nashua Mental Health, which is the Community Mental Health Center for the Nashua region. I want to take a few minutes this morning to address first how the use of telehealth has allowed the mental health centers to continue to offer our patients services during the COVID-19 pandemic. And then second, to offer some detail about how it's been working for us. So during the past few months, using telehealth, both video and audio only options, such as telephone, has been a lifesaver for many of our clients. As a result of Governor Sununu's emergency order, we had the ability to continue offering all of our mental health and substance use disorder services, including assessment, therapy, case management, supported employment, group therapy, and so on. All of the many services that the community mental health centers offer to our communities. We've been able to help parents calm children having panic attacks at home regarding remote learning. We've been able to continue therapy and medication appointments, supporting individuals whose symptoms were worsening due to isolation. We've supported clients even finding work during this time. We've had mail opening appointments where clients on our ACT team checked their mail and made plans to address items if needed while on the phone with staff. Collectively, telehealth has allowed all of the community mental health centers to provide services to thousands of people throughout New Hampshire during this pandemic. Even though many of the community mental health centers, including the one where I work in Nashua, were able to offer video services very quickly, many people didn't have high-speed internet or access to smartphones or laptops to be able to do those services through video. Thankfully, they were still able to access needed services because audio only was reimbursed through the governor's emergency order. This allowed us to work with clients over the phone to address their mental health concerns. Clients didn't need to have anxiety about trying to figure out a video format on top of their other symptoms in order to access treatment. We were able to use three-way calling with individuals fluent in languages other than English alongside an interpreter. As the time progressed, we were able to provide some people with coaching around technology and strategies to address their anxiety, but still many people have been accessing our services through audio only or through the phone. What I will tell you is it is working, both video and phone, continuing to offer services that people need without significant concerns around the financial impact to our practices. Because the emergency order, as Jay mentioned, did require the reimbursement for those services at the same level as in-office services. It's just the modality that's changed. Many clients and staff want to be back in the office, and we're ready to start welcoming them back. Yet, it's become very clear to me that telehealth has given providers and clients options for accessing care. Being able to offer this flexibility in treatment is an essential component for increased access to care for New Hampshire residents needing mental health and substance use disorder services. Before the COVID pandemic, as a state, we identified concerns about our mental health system. We all had concerns about equity, access, workforce. So why would we want to go back to that before, at a time when we had concerns? Why wouldn't we embrace this solution, this 3-month experiment that has been working and has provided access to people, regardless of their ability to access transportation? regardless of their ability to leave their home, regardless of mobility challenges or symptoms that might make it hard to come into the office. What we have really found is that this creative solution has appeared to what we all knew were problems within our mental health system. So I am asking that you support the increasing access to mental health services so that more people across New Hampshire can have access to the services that they need. By supporting House Bill 1623 with its addendum, you are making these telehealth changes permanent, and it is what we need for access to care in our state. Thank you so much. And I will pass it on to Ashley, who's here to talk about her experience.
Good morning, everyone. Thank you for allowing me to be here and speak on behalf and support House Bill 1623. I'm a consumer over at West Central in Lebanon, and just having this access has just been paramount for me. I was in one of the higher risk levels for the COVID-19, so leaving the house produced some anxiety, and my provider was fantastic. She came up with a solution right away. We started off with the audio-only phone calls, and it continued into telehealth. And having that ability to see somebody face-to-face and have a conversation and express my concerns really helped continue the progress of my therapy. I didn't feel as though that we reached the standstill or a speed bump in the continuation of what we were working on. I was supported through the anxiety of isolation. Being alone in my own head was a scary place. So I had access to any of the crisis intervention that I needed, continuing resources through managing stress and just actively combating the symptoms I was experiencing. And just the access part alone is huge. I used to work in public safety, and a lot of the people I would come across didn't have access to vehicles or means to get to therapy, but they wanted to get better and they wanted to fight either substance abuse or mental health or whatever they were experiencing. And I think this bill would allow that. It would, everybody has a smartphone and everybody has access to some way of reaching out. And I think this is just incredible, and it has helped me immensely. And I think especially with the stay-at-home and COVID-19, what has produced some other symptoms, this will help combat. You know, the remote learning, being at home, just kind of being cooped up. It's, I think this is a great way that people can access help. And with anything with mental health, it's okay to fall down. It's okay to need help. And this is just another way of getting that easy access and entering the system and continuing progress. So I've been very thankful, and I hope this continues, because even with working, sometimes you can't get to therapy. You know, you work an 8 to 5 shift, and my therapist and my providers have been great with, hey, you know what, where we're doing the telehealth, I can fit in some extra time at the end of, you know, 6 o'clock or 6:30, and that's been huge for me. And moving forward, I hope this continues, because I think it's just a mainstream experience, and we have technology and we may as well utilize it any way we can to help people.
Thank you so much, Ashley. And thank you so much for these speakers, really very important perspectives in regards to this bill. So I wanted to take a minute to see if there was anyone who had some questions. Again, we don't have the chat section, but if you want to raise your question, there's the raise your hand, which is in the reactions. And we have people on here who can respond to that. Let's see. Okay. Well, that's a good thing. I don't see any questions. Did any of the, Jay and Cynthia, thank you again for speaking and your perspective. Let me unmute you, Jay, if you'd like to. And before we head out, was there anything else that you wanted to close on before this comes up for hopefully passage tomorrow on June 16th?
I think that we have a rare opportunity to make a change that will have meaningful positive impact on healthcare throughout New Hampshire. And I think that this is an important step to take. So I would ask that that legislators and anyone who thinks that they can reach out to legislators provide support for the passage of this bill.
Yeah, I would agree with that, Jay. I think this pandemic has been a time of kind of creativity and innovation. We've had to be creative about how we've provided services. And so it's giving us an opportunity to really change the landscape of what we've known have been barriers to access to care. We wouldn't have to worry about not getting care during snowstorms or harsh winters or people that can't leave their home. We can help with people who have anxiety or other symptoms that make it hard for them to leave their home by starting with telehealth and then moving into in-office services or in community services to help them manage those symptoms. So this really is a rare opportunity, and it would be a shame for us not to embrace it.
Thank you. Wonderful. If anyone has any questions after this and would like to reach out, you can email info@whitebirchcommunications.com. If you have specific questions, I can get them to Jay, Cynthia, or Ashley. I'm happy to do that. So thank you all for being part of this. And yeah, we look forward to hearing about tomorrow.